Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Wonwaka. First, the highlights. States use anti-polio vaccination campaign to sensitize residents to COVID-19 vaccination. Resident doctors resume work after about 2 months strike. And scientists say a rare Chilean tree may be the ingredient for a global COVID-19 vaccine if supplies last. According to the United Nations Children's Fund, UNICEF, 1 out of 6 Nigerian youths developed mental health conditions as a result of restrictions relating to the COVID-19 pandemic. In a statement issued by UNICEF, the findings were the result of a survey carried out in 21 countries, including Nigeria. Early findings from an international survey, which is previewed in the State of the World's Children 2021, a median of 1 in 5 young people aged 15 to 24 were surveyed. It estimates that the current impact of COVID-19 on children's mental health was a tip of the iceberg, as the trend was likely to continue in the next years. It reads in parts, indeed, the pandemic has taken its toll in Nigeria. 1 in 6 young people aged 15 to 24 surveyed said they often feel depressed, have little interest in doing things, or are worried, nervous, or anxious. Meanwhile, 344 new COVID-19 cases were discovered last night in 19 states across the country. The Nigeria Center for Disease Control, NCDC, announced in its daily update on the virus. Let's take a look at the report.
344 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 18 states and the FCT, an increase from the figures reported earlier. FCT recorded the highest infections with 79, followed by Lagos with 62. 45 cases were recorded in Rivers. Kaduna had 33, Plateau 22, Edo 16, Benue 13, Kano 12, Cross River and Delta logged 11 each. Other states include Anambra, Abia, Jigawa, Bauchi, Ekiti, Kwara, Akwa Ibom, Oyo, and Nasarawa, which registered a single-digit infection. The data also includes a backlog of confirmed cases reported from Benue, Nasarawa, Kwara, and Kaduna, 1 death from Benue State, and 40 discharges reported from Plateau. The overall count of confirmed cases in Nigeria now stands at 206,623. 308 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 194,475. Lagos is leading the chart of states with the highest number of cases currently on admission, followed by FCT, Delta, Edo, and Oyo. 8 patients have died from complications in the last 24 hours, raising the fatality toll to 2,731. Presently, there are more than 9,000 active cases in Nigeria, while over 3 million samples have been tested so far. Almost 5 million eligible Nigerians targeted for vaccination have been reached with the first dose, while over 2.1 million persons have been fully vaccinated so far. In Africa, there are more than 8.3 million confirmed cases and over 212,000 deaths have been recorded across countries on the continent. The total global confirmed cases have surpassed 235 million, while deaths are now beyond 4.8 million.
And to Cross River, where the state government has set out to use the news of the outbreak of several hundred cases of vaccine-derived polio to sensitize residents to the merits of the COVID-19 vaccination while they conduct a polio vaccination drive for children. To this end, the Cross River state government has flagged off the first round of the outbreak response against poliomyelitis across the state.
Across the state, these children between the ages of 0 to 59 months are here to be vaccinated against poliomyelitis, one of the highest causes of infant mortality around the world. Polio is a disease that can lead to permanent disability and even death because of its effect on the muscles that help the children to breathe. Leaving no stone unturned, the Cross River State government flags off a vaccination exercise of children across the state to help curb the spread of polio.
We do not have any recorded case yet of the polio, the type 2 polio. However, we have neighboring states that have recorded cases. And you know what it is with polio. Once you have a point where you have recorded cases in a very short time, over 200 within that same community can come down with the same disease. And that's why we are intensifying this outbreak response to ensure that we prevent the outbreak of polio type 2 in our dear state.
Though the campaign is targeted at children, the state government takes advantage of the opportunity to ensure that parents and caregivers also receive the COVID-19 vaccines when they bring their children for the polio vaccination.
We have the vaccination exercise ongoing in the state, and this is also an opportunity for us to ensure that the mothers who have been taking care of these children are not also left out. And of course, we're not just focusing on mothers, all caregivers, both men and women, to ensure that we can also hit our target in the COVID-19 vaccination, while of course not letting our children are not also left out.
The polio vaccination exercise targets over 800,000 children across the 18 local government areas of the state.
And to Anambra, where the State Ministry of Health has disclosed that 22,869 persons have been vaccinated with the Moderna COVID vaccines, while 11,992 others have received the Oxford AstraZeneca vaccines in the state. At a joint press briefing on second dose of the Phase 2 COVID-19 vaccination and outbreak response, the State Commissioner for Health also lists the target group for the vaccines. The Anambra State WHO coordinator also used the opportunity to commend the government of Anambra State for their efforts in the fight against the killer virus and gives reassurances of continued support from all UN development partners to see the elimination of the deadly infection.
The Anambra State Primary Health Care Development Agency will commence vaccination to those who have received their first dose of Moderna, the Moderna COVID-19 vaccine, or who have received their AstraZeneca first dose. The vaccination will take place across 21 local government areas of the state at 72 vaccination posts. Recall that the target population again are 1 persons aged 18 years and above. Those who receive the dose of Moderna COVID vaccine should take along their vaccination cards to get their second dose. It's very important.
We are now in the phase of implementation of the second dose of the first phase of COVID-19 vaccination, and also simultaneously flagging off the first outbreak response against the circulating vaccine-derived poliovirus. We are glad and we are happy with the achievements so far by the government and the people of Anambra State. And we pledge, WHO is committed, and UNICEF is also committed. All the UN partners are committed to supporting the state to have a successful twin campaign of COVID-19 vaccination and the polio outbreak response.
Well, staying with the situation in Anambra State, Dr. Chioma Ezengimulo, Executive Secretary, Anambra State Primary Health Care Development Agency, joins us now virtually. Thank you for joining us on the program. All right, hopefully we will be joined by Dr. Chioma, the Executive Secretary of the Primary Healthcare Development Agency, shortly. But let's go over to Edo State. The coronavirus pandemic could not have come at a worse time, a time when many nations around the world, including Nigeria, are already grappling with insecurity, civil strife, among other challenges. This is coming from the governor of Edo State. Ms. Godwin Obaseki made the comments during the swearing-in ceremony of his first first set of commissioners and special advisors at the Government House Benin City. He insists that the state has not been left out of the impact of COVID-19, which has left stronger economies vulnerable. He charges the new cabinet members to hit the ground running in dealing with the impact of the virus.
Today, we are living in a world that has been ravaged by the COVID-19 pandemic. The world is no longer the same. It's a different world we live in, where we all have to keep social distance from each other so that we don't get infected. The impacts of this pandemic has been very devastating across the world, and also in Nigeria, because it has not only affected us from a health perspective, not only affected our health systems, but more importantly, it has affected livelihoods of our people. This occurring at a time when we're seeing heightened insecurity across the country. These are times when we're beginning to see heightened civil strife in different parts of the world and also in our country. These are very, very worrying times, where in sections of the country we live in, people are not able to go to work because they've been asked not to, and there's nothing anybody can do about it. We are seeing nations fail. We are seeing pressures around us. We're seeing countries where military coups are taking place because of social pressures. We're seeing international institutions challenged like they have never been done before.
And after 8 weeks, the industrial action of the Nigeria Association of Resident Doctors, NARD, activities picked up in some of the hospitals across the country following their suspension of the strike on Monday. The Chief Medical Director of the Lagos State University Teaching Hospital, LASUTH, Professor Adetokunbo Fabamwo, told Channels Television that patients are being attended to in various departments, including clinical areas. Meanwhile, President of the Association of Resident Doctors, Luth Branch, is optimistic that his members will no longer be forced to take this path.
Our people are fully back to work following the directive of the National Executive of Nigeria Association of Resident Doctors, telling all resident doctors across Nigeria to resume. If you go to different parts of the hospital, you will see that our people are fully on ground, and we are here to do what we know how to do best. Patients are happy that we are fully on ground because we constitute the major workforce in the hospital. We are optimistic that we won't have to go this pathway in the nearest future.
In neighbouring Ogun State, resident doctors are back at their duty posts, attending to patients in different wards of the Federal Medical Center, Igaba, in Abeokuta, the state capital. The Chief Medical Director, Professor Adewale Olomu, says the doctors are welcome back and hopes that both parties can resolve the impasse in the interests of the general public.
I went around this morning to see the doctors at their duty post and attending to patients. The patients were so numerous. Actually, the patients that suffered a lot, but they were all around, and the doctors were around. I went to almost all the clinics in the hospital, and I was extremely happy that they are back at their duty post. The expectation is that definitely the patients will continue to receive the services. It will also boost the economy of the hospital, and we can continue to move. A wealthy nation, a healthy nation is a wealthy nation.
Still to come on the program, more on the global situation of COVID-19. Please stay with us. And we've since been joined by Dr. Chioma Ezeyimulu, Executive Secretary at Anambra State Primary Healthcare Development Agency, about the curve in Anambra State. Thank you for joining us on the program.
Thanks for having me. Good evening.
All right, good evening, finally. First, I'd like to begin. What is the day like in Anambra? And this is following the recent outbreak of violence in the state.
Anambra is very calm. It has been very calm today. Apparently, the only days we are uncertain are the Mondays. But today, everything is normal. And in fact, we flagged off campaigns today, as you are aware. Our outbreak response against polio and our second dose of the second phase of the COVID-19 vaccination.
Give us an idea of how the rollout is going. And this is when you compare it to the first phase in terms of the uptake of the vaccines.
Yes, the rollout is coming up very fine. People are very eager, especially those who have taken their first doses. This is actually our second phase. We had done the first phase. At that time, over 62,000 in the Anambra were vaccinated. So now we're in the second phase, and over 24,000 in the Anambra have been vaccinated. So that gives us a total of over 92,000 in the Anambra. So the response has been good. It has been encouraging. People are eager to take their vaccines. For the first dose, we finished all the vaccines that were allocated to us. So we are happy to start the second dose now.
And finally, Dr. Ezeyimulu, it's also been a long 18 months, I mean, for everyone, the whole world. In terms of adherence to the safety protocols, do you still see that on a daily basis?
Yes, because we keep reminding them. At a point, people relaxed a bit. But with the Delta variant, we have since sensitized our people, especially in this electioneering period, that they must put on their face masks, maintain social distance. They should also wash their hands regularly with running water and soap, and of course, use hand sanitizers. So we are adhering to all the COVID-19 protocols.
All right, Dr. Chioma Ezeyimulu is Executive Secretary, the Anambra State Primary Healthcare Development Agency. Many thanks for joining us on the program.
Thanks for having me.
And now to all the stories. Down a dusty farm track in Chilean one country behind a wooden gate, you see wrapped in chains, forestry experts are nursing a plantation of saplings whose bark holds the promise of potent vaccines. Let's see that story and more on our global coronavirus update.
A rare Chilean tree is set to hold hope for global COVID-19 vaccine if supplies lasts. Kile trees, technically known as Pilea saponaria, are rare evergreens native to Chile that have long been used by the indigenous Mapuche people to make soap and medicine. In recent years, they've also been used to make a highly successful vaccine against shingles and the world's first malaria vaccine, as well as foaming agents for products in the food, beverage, and mining industries. Now, two saponin molecules made from the bark of branches pruned from older trees in Chile's forests are being used for a COVID-19 vaccine developed by drug maker Novavax. The chemicals are used to make adjuvant, a substance that boosts the immune system. Research into the killer trees comes as the cumulative total global COVID-19 cases exceed 235.2 million, with a death toll hitting 4.8 million as of Tuesday, and that's according to the World Health Organization. The United States case count exceeded 43.9 million as of Tuesday, with the death toll surpassing 705,000, according to the data released by the Center for System Science and Engineering at Johns Hopkins University late on Tuesday. India's COVID-19 tally rose to 33.8 million on Tuesday, as 18,346 new cases were registered across the country, according to the Federal Health Ministry's latest data. Besides, 263 more deaths were recorded on Tuesday, taking the death toll to 449,260. Russia, on the other hand, reported a record high of 895 deaths of COVID-19 over the past 24 hours, bringing the nationwide death toll to 211,696, according to the official Monitoring and Response Center.
And to news in the World Health Organization has backed a rollout of the first ever malaria vaccine to tackle the scourge of the disease. The announcement was made by the Director General of the Global Health Agency this evening during a press conference. The new vaccine, called Mosquirix, prevents 30% of severe cases of malaria, and it's said by the WHO experts to possess the capacity to save tens of thousands of lives every year.
As some of you may know, I started my career as a malaria researcher, and I longed for the day that we would have an effective vaccine against this ancient and terrible disease. And today is that day, an historic day. Today, WHO is recommending the broad use of the world's first malaria vaccine. This recommendation is based on results from an ongoing pilot program in Ghana, Kenya, and Malawi that has reached more than 800,000 children since 2019. This long-awaited malaria vaccine is a breakthrough for science, child health, and malaria control.
Remarkable news, especially for sub-Saharan Africa. Well, let's take you to Brazil. A Brazilian hospital chain has tested unproven drugs on elderly COVID-19 patients without their knowledge, as part of an effort to validate President Jair Bolsonaro's preferred miracle cure. A lawyer for whistleblowing doctors told senators yesterday at least 9 people died of COVID-19 during the trials at the Prevent Senior Hospital chain, and this is from March to April 2020. But let's find out about the latest on the coronavirus situation, and joining us is Dr. Emmanuel Oluwatuyi. He joins us from Brazil. He's an emergency medicine specialist and psychiatrist. Thank you for joining us on the program.
You're welcome, madam.
Thanks. I'd like to begin. Many Brazilians used to spend about $30 per head on what they call the kit COVID. It was a mix of vitamins and other pills that the president touted as early treatments for COVID-19. And this is well before the vaccines became available. Are people still using that now?
Yeah, the question of COVID kit is not a very true story, really. It happens only in one health organization, one insurance. So, and this process is now being investigated by the Parliamentary Commission of Inquiry. It's not a general use in Brazil. This kit, what do you call it? Kit COVID. It's not a general use. The president has already recommended the chloroquine at the initial stage of the pandemic, but it's not a common use. We are no more using chloroquine. We are no more using ivermectin. So I think that news was exaggerated. Really.
In your estimation, how is Brazil fighting and tackling the pandemic?
Yeah, with the advent of vaccine right now, almost 200 million Brazilians have been vaccinated. And today we have the reduction of the death toll from about 1,800 per day to about 247 daily. So there's, a very combative and aggressive measure against the disease through the incoming vaccine. Today we use 3 basic vaccines, which is Pfizer, the AstraZeneca, and CoronaVac. So they are very, very effective. And I can assure you today that Brazil has already vaccinated almost 90% of the population.
Finally, we understand that Brazil suffered some of its worst death rates yet. Late 2020, early 2021, in heavily ivermectin-dosed areas. And this was also during the more transmissible Gamma variant. What's the government's position now on using ivermectin to treat COVID-19?
Really, the government has not directly informed about the methodology of treatment. The medical doctors here, they have the autonomy to prescribe. So most of the medicine we are using today in the critical situations, they are the antibiotic, such as cetirizine, and combined with the corticoids, especially prednisolone. So those are the medications we are using right now. The government has not directly involved in the method of treatment. The Brazilian National Medical Council has authorized the doctors to prescribe with the awareness of the patient so that you can select a medication for her or him.
All right. We appreciate your input on the program. Thank you so much. Dr. Emmanuel Luatuyi is an emergency medicine specialist and psychiatrist joining us from Brazil. Thanks again.
Thank you very much. You are welcome always.
And finally, you can take a look at more updates on our website. Remember to continue to take responsibility. You find some breaking stories. It's channelstv.com, and the news is always at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Morgan. Stay healthy.